Hi class, and welcome to week 11 of Cultural Diversity or Diverse Populations. I am your professor, Amber Donovan, and I thought I would introduce myself to you after we've had a week of trying to get to know each other a little bit. I am a professor at Lorain County Community College and at Cleveland State University. I teach part-time for both, although I think it's pretty much full-time this semester. Last week in this class, I had you watch a video on cultural humility. And that's because the most important thing I think you can do is take a learning stance when it comes to meeting new people and meeting clients and trusting that they are the experts on their own life. Oftentimes people will not remember what you say to them, but they'll remember how you make them feel. So for me, the most important thing in relationships and when I'm trying to build trust and relationship with clients is that I'm curious about who they are and their story, and that I'm able to lean in to what makes them uniquely who they are. So that's really the key for those of you who want to be a social worker or in the human services or even in nursing. It doesn't matter what field. Understanding different populations of people and taking a learning stance, being curious, being a lifelong learner, like what the doctor talked about in her presentation on cultural humility, really ties in nicely with cultural competence. Every person in every unique group has their own unique characteristics, so it's really important that we don't make assumptions about people based on whatever group of people or whatever their background is. It's important that we treat each person as unique. Everybody has their own story. When I was a social worker, I was a clinical social worker both at Applewood Centers, which is a mental health facility that serves families and children on an outpatient basis. I specialized with children who are working with children and families who are impacted by sexual abuse. I did individual work with them, group work, and family work. And it didn't matter if I'd heard a story, an abuse story that was similar to somebody else. It didn't matter because everybody's story is unique. So this week, as you do the projects, and next week as you do the projects, I want you to remember that although you're reading somebody's day in the life of working with a certain population, be very careful to extrapolate that situation to every situation. That particular project is based on that particular social worker's experience. So the most important thing for developing cultural competence is to, one, be aware of differences and embrace them. Are you a person who holds back, kind of leans back when you're uncomfortable? Or are you a person who challenges yourself to lean forward and to listen, even if somebody says something that you don't agree with or has a different view? We're kind of at a point in our society where people don't understand that listening doesn't mean agreeing, that listening is just a matter of civility, of treating other people the way you want to be treated. And so oftentimes with cultural competence and with working with people from different backgrounds, we come with predispositions, we come with preferences and bias, and through that project Elicit that y'all have done now for 2 weeks, that's the last time. The idea behind that is to understand that we all have unconscious bias that we're not aware of. We all do. And the more we can be aware that we may have preferences towards or against different people, the more we can work really hard to open our ears to listen even more closely, to challenge ourselves that we don't know everything about other people's stories. Even if I've worked with 1 million children with ADHD, every child with ADHD is different. Every family system is different. So it's really just important not to close off and assume, make assumptions about people. It's really important to have an open mind. And people have lots of hard things that they survive in their lives. Lots. But oftentimes when they come to social workers or to a helper for assistance, they feel like they're going to be judged and that they feel as if it's a sign of weakness to seek help. Those are all misconceptions. They're myths. It's actually a huge sign to admit that you need help of strength. And it's a huge part of understanding that, we're really not meant to live in isolation. We're meant to live in a relationship and be connected to one another. But there's a sense of vulnerability that if you listen to somebody else's story or you share your story, that you'll be judged for who you are, that they might hold that against you negatively. But it takes courage. This whole diverse populations, this whole learning about different people, it takes courage. And courage really comes from the word cur, which means the heart. And at the heart of the matter is really who we are as people. So this is just my little 5 cent, what it takes to have cultural competence as a social worker. I'll give you more ideas as we go through the semester, but this is just my introduction to you. I also used to work at Rainbow Babies and Children's Hospital, and I, again, worked primarily with child abuse, but I worked in the emergency room. I worked in the special immunology unit, which is with adults that have HIV or other special immunological challenges, and I also worked with preemies in early intervention programs. So I had a lot of diverse experience, but most of it was through crisis intervention, and I had to really come to grips really early on that in order to give really fully to the clients that I was working with, it was going to require me taking a stance that I'm just learning about people. It's just a curiosity. Tell me about your life. Tell me what your experience has been. Tell me how it's been for you. And then tell me what you want for your life. What are your hopes? What are your dreams? You know, there are some things that we have in common, you know. And so those are kind of some of my philosophical thoughts about it. The other thing I would encourage you to know is that if you are going into social work, cultural competence is not an option. Working with diverse populations isn't something that is just a theoretical pursuit. It's 100% important for ethical practice. In other words, in order to help people, you have to be able to be open to all people. And if you have bias or prejudice against a certain group of people, or more people would say that they have opinions about what people's behaviors are, maybe not a people group. But some people are against abortion, some people are against gay marriage. And how are those beliefs and values going to impact your ability to work with people in those diverse populations? So over the next few weeks, that's really what we're going to be talking about. And so those are the things I want you to be thinking about as we go through the lessons, as we watch some of the videos, and then as we continue to have discussions. So it's nice to meet you. And I hope you enjoyed this little video. Not sure there's going to be many more. This is real awkward for me. But I wanted you to just kind of hear a little bit straight from my mouth. Okay, have a great weekend, and I will talk to you soon. Bye.